Good afternoon, and thanks for that introduction, John. I wish I could be with all of you in Austin, and personally thank you for what you do every day. A special shout out to John Bindus, who's the CEO of our School Community Health Alliance of Michigan, to all of my Michigan friends who are with you in Austin, and to everybody who's a provider or an advocate for our children and school-based health centers. Thanks so much. And congratulations on 20 years of being a champion for giving our children access to quality healthcare services in their schools. Thanks to your work, we've reduced the need for high-cost services, we're improving student performance, and you've increased access to healthcare, including mental health care, which is so critically important. Thanks to you as well for honoring me in February with your Policy Champion Award. It meant so much to me. It's been my great honor and pleasure to fight alongside each and every one of you on behalf of our children and their families. When we did the Affordable Care Act, I was very pleased to be able to make sure we had $200 million in the Affordable Care Act for school-based health centers, and I know it's had a far-reaching impact, and by the way, we need to continue that, helping reach 2 million students all across the country. But our work continues. We need to increase dollars. Now that we have built new facilities and you've renovated the old ones, our next challenge is to get funding to support the actual services, all the operational expenses that come with serving children in our communities. I believe school-based health centers deserve dedicated funding, and that's why I'm working with many of you on legislation that will address school-based health centers for the long run. We really need to get that done, and I need your help to be able to tell the story of the difference that you are making in children's lives. You know, when we work together, we can get things done. Look what we have been able to do expanding the Children's Health Program just a few months ago. Working with all of you, we were able to pass an 8-state demonstration project for mental health services in the communities. Working with you, we were able to get the initial funding for school-based health centers and health reform. So I know that we can keep going and continue to have successes if we work together and if we had loud advocacy from each and every one of you. And right now, as we know, the K-12 education bill is expected to come to the floor of the Senate in July. So right now is when I need your help. Please continue reaching out to the members of the Senate committee so that they understand that school-based health centers are very important to children, particularly providing critical mental health services. I know that there's a new generation of leaders coming up within your ranks, as well as those who have been around a long time, like me, who have worked hard and continue to feel very, very passionate about this important work. 2 decades, 20 years, is a long time to be out there fighting for our children. You are making a difference. You have made a difference. And we've got to continue to do that together. So thanks so much for what you do, and I hope you have a great conference.